Welcome to a quick overview of the Google Health Wave. The Google Health Wave can be used to make patient care safer. What we see is we have two windows. One on the right, which is the Google Health Wave, and the window on the left, which is a GWT component that is aware of the patient. Basically, in the future, what we're going to do on the left-hand side is we're going to use Google Visualization to display and mash up Google Health data. Google Health data is a central repository for all your health information. Here we'll be demoing the medications and the allergies. On the right, we see we have a Google Health Wave. A Google Health Wave is a wave which is aware. It's basically logged into Google Health, read all the patient information, and can act upon it. In a typical scenario, we have a nurse and a doctor working in a wave. The wave can work autonomously in real time. In this scenario, it will simply answer questions from the doctor and the nurse. Here we have a fictional doctor. We'll call him Dr. Doogie. He's not a real doctor, he just plays one on TV. And Dr. Doogie is about to make a prescription for this patient. And he's basically going to say that he wants to administer penicillin to this patient. But before he can do that, the nurse sees that he's about to administer some penicillin. And what she does is she says, wait a minute, I think he's allergic to penicillin. So she's going to ask the patient-aware wave if the patient is allergic to penicillin. The way she does that is she makes the wave aware that it's about to be asked a question. And then she says, check for allergies. And by doing so, the wave goes down, looks at the health records, and deciphers that yes, he's allergic to penicillin, and highlights it. Here we simply highlight it, but we can do a number of things, including sending SMSs, sending email, bringing up more information about penicillin, and specifically the different reactions that this patient had to penicillin. Now our Dr. Doogie is kind of concerned. He doesn't really understand how he missed that the patient was allergic to penicillin. So what he's going to do is he's going to ask the wave, what other things is this patient allergic to? And the way he does that is, again, he simply says wave list allergies. And with that simple command, the wave shows the doctor all of the allergies for this patient. Now the nurse also says, I'm a little worried. I wonder what other medications this doctor has given him. So what she can do is she can ask the wave to check the different medications that have been administered. So again, she just says, wave, check meds. And when she does this, we can see that the doctor has prescribed S2. Now, not only can we flag this, but we can look for drug-to-drug interactions, and we can also look for recommendations and other information. But we see that S2 is administered, and the doctor's a little worried. He's wondering, okay, what other medications is this patient taking? So he could simply ask the wave to, again, he's going to say wave, list the meds. And what we see here is a list of the medications that this patient is currently taking. The nurse or the doctor can leave on the wave directive to check their work in real time. Here, we'll check for allergies. And we can see that penicillin was picked up as something that the patient is allergic to. We can do the same thing with medications. And here we see the Red Cross toothpaste and the S2 were picked up. Now this is just a quick example to show what the Google Health Wave can do once it's patient aware. In the future, we'll be doing lots of drug-to-drug interactions and making suggestions and showing procedures and other relevant medical information. This has been just a quick demo of the Google Health Wave, the world's first patient-aware wave. Thank you.